And remind you all that the August recess toolkit is actually continues to be completely useful and activities worth undertaking until Congress comes back, which is on September 13th. So you have plenty of time to keep doing that activation. We will be encouraging you all to take to social media over the next few weeks. There are new resources coming from Marketing for Change that will apply a lot of this messaging research and findings from that polling you just saw to make it really easy to create a lot of noise on social media. So that's going to keep being important. And a lot of that activation has been related to some of the media you all have seen, the good press on these issues. So that does make a difference, even when it doesn't feel, like it may feel like you're kind of screaming into the void sometimes, but it really does make a difference in keeping the energy up around an issue. And then I will say, if there are oral health providers on this call that have not been, interacting with their members of Congress, or that have not used the August recess toolkit, who are, have in line with Open's policy priorities, it is helpful for you to kind of indicate that you are a dentist or an oral health provider that sees the policy and is supportive of it in the way that Congress is working on it, and that you're consider I think that raising your voice as a provider in the context of this specific policy is important, since we know that there is a lot coming from a lot of different ways. And if you're raising your voice in I know there are a lot of ADA members that are part of this too, and if that's where your policy position lies, that's fine too. But all of your voices are going to be really important in keeping this train moving and making sure there aren't concerns that dentists won't participate in Medicare in the end. So keep an eye on Open Communities for updates and action alerts. All these resources are coming soon, but I do encourage you to keep activating with the August recess toolkit. And that, as I said, once we see Congress come back from Labor Day and their Labor Day recess, and we see the specifics of a policy proposal that is coming out of committee, we will be taking action to hold members of Congress accountable, so that they really understand that this is something they have to deliver on. They can't just put a good proposal out and let it die. So that's where we are. And I'll turn it to Lori now to talk about the Chief Dental Officer